Hello, everyone, and a very, very warm welcome for joining us today. My name is Ava Wild. I'm a member of the Youth Hub Steering Committee, and also part of the online conference team and the Call for Action Working Group. So truly, on behalf of all of us, of the whole organization, we are very, very happy to have you all here for this event, for launching the call to action of the Global Health Workforce Network's Youth Hub. Before we start, I would like to also mention that this session is being recorded. Secondly, please feel free to put into the chat where you're from. Thirdly, tomorrow is the beginning of the World Health Worker Week. So that's also one of the reasons why this webinar is happening today, is to sort of unofficially start this wonderful week of celebrations. Good. So perhaps with this, I would like to walk you through today's agenda. So today, what we will be having for you is essentially 2 or 3 parts. So initially, we're having an introductory part where opening remarks will be provided by the World Health Organization's Health Workforce Department, Mr. Pascal Zurn. After that, I will be introducing to you the Gwen Youth Hub's call for action. Followed by the introductory part, there will be probably the most exciting part of this whole session, which is the panel discussion. So the panel discussion will include several experts within the field of global health, health workforce, youth. It will be moderated by one of our Youth Hub Call for Action team members, Ms. Catherine Fang. And really, we have a wonderful selection of speakers in front of you today. There is also an opportunity, and I really warmly recommend you to do this, to ask questions, right? So we will be selecting some questions at the end of the session for the speakers to respond to. So grab your phones, or if you're on your phone, then open Menti. So there is this QR code which you can scan, or alternatively, you can go to menti.com and you can enter this code. And following this, then you will be able to submit throughout the whole session on the background your questions, which you may have. Secondly, what I would want to mention as well is that we really, really appreciate you being active on Twitter, on social media. So if you check the below, let's say the lower part of each slide, then you can see our Twitter handle. You can also see some hashtags that you can use for sharing information regarding this webinar. Good. So I guess with this information, I would like to hand it over to Pascal to open the webinar. Pascal, please, the floor is yours.
Okay, thank you very much, Avi, for this introduction and for introducing me. I'm very pleased to be with all of you, although I do not really qualify as a youth. So for me, it's a great pleasure to be with the youth. And I'll be very happy to also make this presentation. I will just share the screen and find the presentation. Okay, perfect. So can you see the presentation?
All good, we see it.
Okay, perfect. So I'm very pleased to be here because it's also for us in WHO important to reiterate that your youth hub is very important for us. You're doing a very important work. And I think also in terms of current actor or future actor in the health and care workforce, or in the way you will or are already influencing the landscape regarding health workforce, is something very important. And we're really very pleased to be part today of that important event, which is the launch of the call for action. And I think it's even more important given the context of the health workforce today, And in the presentation, I will also highlight the current context, the difficult context, and hence the importance of having a strong engagement of the youth in this area, which is very important for the future. So, yeah, so the slide is not moving. Alors, let me see if I can find a way to move. Ah, yeah, okay. So I think it moves with a bit of delay. So a first important element to highlight this current situation with the health workforce is of course related to COVID-19. COVID-19 is having a strong impact on health system, health services, health workforce. And WHO have regular survey questions about how COVID-19 disrupt health services. And what we can see here that there are a lot of countries where the COVID-19 is disrupting health services. So that is something already important as an element. Now, when we looked at those surveys, there are already 2 that have been done on a regular basis. The area where this disruptions is very, or the most important, relate to a health workforce issue. And you can see on the top right of the graph that the primary cause of the disruption in 66% of the countries is insufficient staff to provide the routine services and the emergency response. So that is really something highlighting that in a current context, and I will come back to this, where already there were a lot of challenges regarding health workforce before COVID, the COVID-19 adds another big challenge in terms of health workforce, and that is really the most common challenges when those survey demonstrate clearly. Now, if we looked even more into details in terms of when we want to provide health services for people to access COVID-19 health services, there are different bottlenecks. There were 4 major bottlenecks that were identified. One on the left side is related to diagnostic and testing. Another one below is in terms of access to therapeutics. Another one, and very important one on the top right, regarding to personal protective equipment. And the last one regarding, also very important, vaccination. And what do we see that for all those bottlenecks in terms of providing services related to COVID to the people, is that the health workforce challenges is identified as a major challenge for the provisions of those services. So here again, something as an important challenge of the health workforce related to COVID-19. And the COVID-19 has a big impact on the health workforce itself. We have been carrying out some country case studies in order to assess what is the impact on the health workforce of the COVID. And first, and it's the top right on the right, is on the health of the health workers. Health workers are there to treat patients, but at the same time, and this is what have been seen in many countries, they've also been victim of COVID-19. They've been infected. Unfortunately, there's been death. It is estimated that around 115 health workers have already died because of COVID, which is unfortunately a huge amount of people. And then not only directly affected in their health through infections or death, but also in terms of morbidity, in terms of stress, burnout, or mental disorders, because there's a lot of pressure that the health workers have been faced in countries, especially in the beginning where equipment were not available and they still had to provide some care. The changes in the way the work was organized, the unknown about the disease. So that put a huge amount of stress and mental health that in the beginning was not, unfortunately, really perceived or taken seriously as it should have been. And now there are more studies pointing out the importance of really addressing this issue. There's also, in terms of how it disrupted the services, in terms of availability and distribution, it has an impact of shortages and vacancies that were not being able to be filled because people were with the disease or they were in quarantine. It was preventing the surge capacity. Many people were on sick leave. So there was a lot of issues that affected the availability and the distribution of the health workers. And of course, all those combined affected the working condition. And we saw issues of people, doctors, nurses, other health workers in the beginning had to work without a proper personal protective equipment, having to be in quarantine, having only temporary staff contract, that it was also an issue. Some countries had to react quickly. They they thought that, okay, we would do a recruitment of staff on a short basis and a quick basis, and that led to some, I would say, sometimes very short contract with not necessarily all the good working conditions. And the paradox was that in some countries that led to strikes. So if you can imagine a context where there's a need of more health workers, there are some policies in place to react to this in terms of recruitment, in terms sometimes of promise of special bonuses. And then in the reality, due to various issues, equipment was not there. Some of the promised additional incentives were not delivered. So we had strikes in those countries facing a lot of challenges. And also the last point in terms of social and well-being, some discrimination or stigmatization against the health workers. And we see, or unfortunately we saw in some countries, health workers being aggressed, being molested, because they were dealing with COVID-19 patients. So really not an easy situation. And to illustrate that, here, it's just to put things in perspective. So if you look on the left side of the graph with all those nice cubes, the first one illustrates the situation before the COVID, where you can see there's a green part and a bit of a transparent part. So the green part is the workforce, and then there's a difference between the green and the white. And then you can see that this gap is the current shortage before the COVID. But with the COVID, because of all those aspects I just mentioned in terms of infections, death, redeployment, protest strikes, the gap is even increasing. And now and this is the problem some countries are facing, there's a lot of vaccination campaigns that have been initiated. So if we add the needs of additional health workers for the vaccination to compensate for the one who are unfortunately passed away or who are infected and in quarantine, to compensate for other services, you can see now the gap will even increase. So we have a situation that instead of improving in terms of the number of health workers, we have, given this pandemic, a situation where the shortages is increasing. You can see that it's a different level in different parts of the world. Now, if we looked beyond the COVID, I think this is also a picture, a very interesting picture that is a projection. So we always have to consider a bit with caution when we have projections, but it's always interesting to see what it shows. This is the amount of the estimated global health workforce shortage for the world in different time. One is in 2013, so it was before, it was a basis for the estimation. A most recent one has been done in 2020, and then a projections for 2030. And the different colors represent different geographical areas, which are the world according WHO. WHO divides the world in 6 regions, and this is the amount of the gap in terms of health workforce for each of the 6 regions. So what is interesting to see, there's some good news, but that was done a bit before COVID. So we need to adapt a little bit this, but hopefully the trend would be the same. But it also shows the challenges when you want to do some projections, is that you cannot account for everything. But the interesting element here is that the trend shows some good news, is that there's a decline in the global health workforce shortage overall. But at the same time, you can see that that decline is not the same everywhere in every region of the world. You can see that in SER is for Southeast Asia, it's the biggest decline between 2013 and 2030, which is really a very good news. Where we should have a concern is that for the African region, which is the AFR, which is the first block in the graph, here the situation doesn't really evolve in a very positive way. And that is a concern, because this is where we have a lot of challenges in terms of the health workforce, and where the health system faced really difficulties and are weaker than in many other parts of the world. So that means that with something like COVID or a new pandemic, or I will come back to that also, with a difficult economic situation, that might have a big and negative impact for the health workforce in that region of the world. Now, what is important is, in that context, so WHO have developed different policies. I would say some that are part of policies that have been developed some years ago, and this is an important one. This is the first one on the graph on the left part, which is the strategy on human resources for health. And here, that strategy is really our, I would say, our guidance for working on the issue of health workforce, with different objectives in terms of facilitating the achievement of the Sustainable Development Goals by 2030. Also important in that respect is the work of the High-Level Commission on Health, Employment and Economic Growth, which published an important report in 2016, which is a joint collaboration between WHO, ILO, and the OECD, where the key message is really to say, and that have been demonstrated by this report, to show that the health workforce is an investment and should not be considered as a cost. So really the idea here is to say that we need to strengthen health workforce, because it's a good investment, and it's a good investment that contributes to inclusive economic growth. And it's very important because it's an important sector for the youth and also for women. And that's why we need to invest. There's a lot of return of investment, beyond the health sector. And following this, to help to implement, to put in place the recommendation of the Working for the Commission, a Working for Health program has been developed with the first part from 2017 to 2021. And now this is the last document. A new action plan for the Working for Health will be discussed and hopefully adopted by the World Health Assembly in May, which is about protecting, safeguarding, and investing in the health and care workforce. And it also highlights the importance of the youth, as you know, because there's been some consultation with you and women in the health workforce. So really something important, and I think it's here that your hub also can and should play an important role in the context of the Working for Health. I would say not only for the adoption, but afterwards, when it is adopted, to also facilitate the implementation, the advocacy for it. That will be something I will think is really great and important to do. In that action plan, that I just mentioned, it is divided in different elements. If I take from the upper part in terms of direction, so one, and it's built a bit on the strategy of the WHO workforce. One is to optimize the existing health and care, and I will come back to this. This is also important because we know we have a difficult context economically. So usually if we want more resources, and this is a lot of the challenge that Ministry of Health is facing in many countries, is when requesting more resources from the Ministry of Health to the Ministry of Finance, usually one of the questions asked by the Minister of Finance is, okay, but before we consider giving you more money, are you sure you are making the best with the resources we are giving to you? So that's why for this new action plan of the Working for Health, optimizing is very important. And from that, we need also to build, to strengthen the capacity of the health and care workforce to address the shortages, and then to strengthen the protections and performance of the health and care workers. So, and this is divided, so we have different areas of work that we think are important. One is in terms of planning and finance. This is an important area of work, notably in terms of getting better data, getting a better planning and investment plan. Then in terms of education and employment, here there's the idea of training enough health workers, but very importantly, to be able to absorb them. That means to recruit and to retain them, and to be sure that the training, the education is really related to the needs of the population, and that all the training and the delivery of services by health workers is of quality. And given the issue of the COVID and other possible pandemic, also the issue of protecting the health workers is very important, to be sure that they are provided with safe but also decent work condition in order that they can perform well. So really the key message is about protecting, safeguarding, and investing. Alors, quickly, this is important to mention as well, is we're talking about that need to invest better and more in the health workforce for the member states. But at the same time, one big challenge that we face is because of COVID, and now unfortunately even more so with the current event in Ukraine, is that the economic recovery that we were hoping for is unlikely to happen, and that countries and that were hoping to spend more money, public money on health, are unlikely to be able to do so. And the paradox here, you can see on the graph, the lower curve, which is for the low-income countries. So this is the government expenditure as a percentage of GDP. So the low-income countries are the one, and it's not surprising, that spend the least of on government expenditures as a share of GDP. And it is becoming now a challenge because those are the countries that would have to spend the most if they will, or if they really need to achieve the SDG targets and for health. And the health SDG target is the one that requires the most investment, in particular the health workforce. So health workforce is the biggest investment for the health DG 3, which is health related. And unfortunately, we can see that the projection shows that for low-income countries, those are the ones that are the most unlikely to have a bigger share of government expenditures available or in the future to spend in health system, because their share as compared to GDP will not increase very much. So that's why it is also important now that with notably the Working for Health, other partners are joining in terms of international financing institution, bilaterals, and I think here also the youth hub can play a big role. And I think finally also in order to be sure, and notably in that context of the pandemic, WHO has developed what we call a compact and health and care worker compact, which really aim on how to best protect health and care workers and to provide guidance to member states, to different actors, to be sure that there's decent work and the rights also of the workers are well respected. And this is really like a guidance tool. The idea is to put together a lot of documents also from ILO to have this available and to learn from the lessons from COVID, where health workers, with some of the example I gave you, were facing a lot of challenges in terms of their rights, in terms of decent work. So those were some of the points I briefly wanted to highlight, and thank you very much for your attention. And again, I'm very happy to be part of that launch, which is an important event. And congratulations to all the members of the Hub for the development of that call for action, which is very timely and very important. Thank you very much.
Thank you very much, Pascal, for the wonderful and very, very informative presentation. And thank you for the good wishes as well. Perfect. So I will continue from here. So I'll talk briefly about the call for action. Just a couple of slides. So the Youth Hub is one of the hubs of the Global Health Workforce Network. So we are focused on youth policy. So to engage youth in relevant policy dialogues, for example, to ensure that students and early career professionals are aware of their rights, are aware of their rights and their needs on national, regional, and global levels. We also support interprofessional youth collaboration. Our steering committee and the whole organization is quite interprofessional, consisting of various youth organizations within healthcare and also across various sectors. We have essentially three pillars: research, advocacy, and the convening space one. quite a lot of members and also organizational members as well. So jumping into the call for action. So what is the background of this call for action? Where does it come from? Why did the Youth Hub decide to put this document together? So last year, we organized so far our biggest conference with more than 1,100 attendees, several expert speakers who presented and engaged in discussions across a 2-day conference in May. So I'm quite sure that several of you also participated last year. Several of you also participated and provided input for this call for action. Because last year, essentially what we did is that we had several sessions around the topic of resilience and adaptability when it comes to the youth health workforce. Of course, the pandemic was a key feature as well that ran through several sessions. Here you can see on the slide various sub-themes that we also had some sessions on, and presentations and also discussions. There were also a couple of networking sessions where youth from across the world could discuss these matters, discuss what they had heard during the day, had a chance to highlight problems, discuss, ask questions, and hopefully also find some solutions. So all of these inputs throughout these various numerous sessions were recorded by our team. They were categorized, systematized, analyzed further, and then put into initial draft of the call for action. So this is a presentation, or this is a timeline of the whole process. So as you can see, we started in May 2021, and now we're almost in May 2022, so a whole year. So I'll just walk you through some of the steps that were quite essential when putting together this document. So we started with the online conference. By July, we had an initial draft. At the end of July until the end of August, there was an open consultation. So this open consultation was shared among our members, among our member organizations, to spread widely as well across their networks. We also had on August the 12th, a Youth Day webinar organized by the Hub, which also presented the call for action, the initial version of it. In September, we organized also a webinar, which was a closed consultation session with specific organizational members. And then essentially after all of these inputs, so inputs from a period of roughly 3 months and consultations and rounds and refinements, we have reached to April this year. So now we are here in the moment of having this call to action launch event. Shortly after today, we will also start collecting signatures, so public signatures and organizational signatures. So if you are interested, please do endorse this document. You will receive a follow-up email, and also on social media, we will be sharing the options. So by May, so by the World Health Assembly this year, we hope to have a final call for action, which has already been endorsed as well by the public, by youth organizations globally. Good. So I really do hope that all of you have checked out the call for action already, or if you have not, then please do scan and read it through. I won't go into a lot of details because this is a matter of you to read and go through. On this slide, you may see some stakeholders who we call on to take action. These include governments, academic and research institutions, media and communications, professional bodies, the private sector and businesses, and also the civil society and non-governmental organizations. Perhaps to wrap up my parts of this presentation, before jumping into the actionable points, I would like to say that there is no health without a resilient health workforce, and no resilient health workforce without adequately cared for and emotionally balanced young health and care workers. So how can you use this document? This document can be used as a means of youth engagement. You can use this to discuss with local policymakers, with global policymakers when it comes to issues related to young individuals, the youth health and care workforce, and related sectors. You can use this call for action as a basis for youth-led entrepreneurial activities and collaboration to partner up with different sectors within health to better the health and care workforce. Then also what you could do is use it for advocacy for evidence-based health workforce education and training. For example, to use it to advocate for health and care worker rights across different institutions and different stakeholders. And finally, what you can do is that you can use it as a tool that is useful to you, to your community. You can customize it, you can contextualize it, and you can use it. As you have seen when you read the document, it is global. It is perhaps a bit wide, but it is definitely useful for you guys to pick up some meaning and some points that really are important for you. So please do engage, do read, do customize, do share the document. If you wish, please also endorse it, sign it, so you can scan another QR code. I think it's the third already in this webinar. So you can also scan this one to sign the call for action. Good. So with these remarks, I would like to thank you from my side, and I would like to hand it over to Catherine for the start of our wonderful panel discussion. Catherine, the floor is yours.
Thank you, Ave, and good morning, good afternoon, and good evening to everyone, wherever you may be on this call today. It is absolutely a pleasure to have you all join us for the launch of this call for action document. As Ave has mentioned, this document does call upon multiple stakeholders to support the youth health and care workers. And so fittingly for today, our panel features speakers representing a variety of these groups. First of all, we have Amy Reza-Bruniak, who is from the Nursing Student Steering Group from the International Council of Nurses. Amy, thank you for being here. We also have Manon Pijolet, who is from the Junior Doctors Network at the World Medical Association. We also have Shelley Reynolds from Queensland Health. She works in rural and remote health for Aboriginal and Torres Strait Islander health workers and health practitioners. And finally, last but not least, we also have Raj Shah from Unleash, and he is a secretariat of this program that does a lot of work in SCG innovations. So thank you to all of our speakers for being here, and thank you for making the time to come and speak on our panel. I think for starters, I'd like to just open with a very general question to everyone on our panel today. Basically, just in your opinion, if you could share with us, what do you think are the biggest challenges in your area of work currently facing the youth in the health and care sector? And what are the consequences that we'll see if we do leave youth unsupported in these challenges? And I might go first to Amy, and then Manon, Shelley, and then Raj. So Amy, if you could speak to that, please.
Absolutely. Yes. Thank you again for the invitation to the event organizers, and welcome to all the attendees. So yes, to address the challenges piece, just looking within my context, which is nursing, to looking at the call to action, some of the words that stood out to me were exhaustion, overstretching, felt by our youth across the globe. And additionally, echoing Pascal's words earlier this morning, just that piece that really this has been present before COVID. And it seems as though the pandemic has really shed a light on these challenges and also what that potential impact could look like in the future. And, you know, when we're looking at the future within healthcare, whether it's medicine, nursing, dentistry, pharmacy, really it's in the hands of our youth. So we're seeing our youth who dream of becoming, and I'll use my context, a nurse, those who are in their nursing education programs, and also those who are early career nurses. So within that, maybe that first 5 years of practice. Now, the significance, these challenges that we're seeing within nursing, according to the State of the World's Nursing Report, which is available on the World Health Organization's webpage from 2020, within nursing, we actually make up the largest occupational group in the health sector, close to 60%. 59% to be right on accurate. Now, like any profession, we're a large group, but we are not invincible. And we are seeing natural progressions in nursing. We're seeing retirement rates. We're also seeing the emotional burden of work as a nurse with the pandemic. And according to the ICN, and this was February 2022, they've looked at this a little bit further. And we're looking at, with the natural progression piece, 4 million nurses globally expected to retire in the next 10 years, which is a huge number. And also looking at a shortage of 5.9 million nurses. So our profession is really in a precarious position before the pandemic, which was according to our ICN. And where does the youth fit in? Well, we're looking at the future and how can we sustain our profession? And it's not unique to Canada. Like in Canada, we're seeing our average age of our nurses is 44. So a little bit on the older side. But additionally, we do have a wealth of future. We have under 35 years of age, our nurses make up 31.5% of that population. And what a powerful group that we really want to encourage and support to be able to stay in the nursing field, become the future, and guide the future that's coming after them. And some of the words, I kind of put them into quotes, 3 really quick ones, about the progression of sometimes what nurses might feel when they enter the profession, or perhaps they're still in nursing school and starting to feel those burdens. We'll hear words like, I didn't think this is what nursing would be. I don't know how much more I can take. And in the ultimate, I guess that I'm not cut out to be a nurse. And this unfortunate trajectory leads to our effects, which I'll speak to next. And if we don't address these challenges and support our youth, we're seeing it before they even graduate. And in my perspective, I feel one's nursing career really begins when you start your nursing education and you start to find yourself, your identity as a nurse. And we're seeing students attrition rates perhaps higher, challenges within the education, so they're not even getting to the end and graduating and moving on. And then if they do graduate, we are seeing quite a bit within that first 5 years reach that point that I spoke to earlier, where they're saying, I just don't think I'm cut out for this. So it really is of significance to address our youth as soon as possible, get those supports in place. And I've spoke to some of the challenges and effects within the nursing context, and I look forward to hearing my fellow panelists and their perspectives within their respective fields. Thank you.
Thank you so much, Amy. And I think it's quite profound how you've highlighted the sort of burnout effects that it has on nurses, and particularly such young nurses as well. So thank you for speaking that, and I'm really keen to hear a bit more on that from you later in this panel. But I think next we'll go to Manon for your response on this. So just quickly rephrasing it, pretty much what are the biggest challenges that you face in your area of work, and what are the consequences that we'll see if we do leave youth unsupported in these areas? So if you could speak to that as well, please, Manon.
Well, first of all, welcome everyone, and thank you for having me on this panel today. I present the Junior Doctors Network at the World Medical Association. We essentially represent doctors who are in the first 10 years after graduation from medical school. So the majority of them do some kind of postgraduate training at that point in life, but we also represent people who have already finished their postgraduate training, people who went straight into the medical profession without additional training. So we have a mix of all those people, but the majority of people we represent are still in some kind of postgraduate training. And so I think one of the biggest challenges that we face in that phase between being full on in the workforce and no longer in medical school is that many countries actually lack access to quality postgraduate education. This means having the availability of having enough training spots, and that is actually an issue everywhere in the world. I don't think there's any country that has sufficient postgraduate training jobs or offer enough positions to their outflow out of medical school, but also offer enough positions to truly care or cater for the needs of their population, like what we see. Or we see in a lot of low and middle income countries that there are just not enough spots, irrespective of the subdomain. What we see more in high income countries is that fields like psychiatry, family medicine, not enough people go in. There's not enough funding. It becomes a very vicious cycle of those programs not being able to sustain themselves, so they don't have enough outflow. While in more richer programs like surgery, we see much more people going in, much more money flowing in. And so in high income countries, there tends to be much more of a disbalance in who does what. But essentially, every country in one way or another faces a lack of adequate postgraduate training. To build up on that is that being correctly paid for that postgraduate training is also an issue. You might say, like, why do you need to be paid to be in training? We aren't paid either. Perhaps, but we are the ones that you see in the ER. If you break your foot and you go on a Friday evening to the ER, it's going to be us. It's not going to be the attending. It's not going to be the fully trained surgeon or ER. It's going to be us. We are the ones rounding at 6 a.m. on a Saturday morning, on a Sunday morning. We are the ones that are being called on a Tuesday evening when someone forgot to put in the labs. I mean, we are the actual doctors that you see most of the time. And for doing all that work, even though that there is a training aspect to it, we do deserve to be adequately paid and to be adequately supported and build a life like anyone else does between 20 and 30 or between 25 and 35. And so what are the consequences of not providing us this training or not providing us the financial support is that people drop out. People drop out, people seek opportunities elsewhere, or people stay in the country but just leave the medical profession. And so essentially, all parties lose out. The medical, the Ministry of Health loses out because they invested all this money in training people and they don't flow into the workforce. The student loses out because they put in all this effort and they actually cannot do their profession. The patient loses out. So this is really a field where the investment will really, really make worth what we put in tenfold at least. So yeah, that was my 2 cents on this.
Yeah, thank you, Manal. And then I think it's really interesting how you highlight such a similar issue that Amy sees within her sort of nursing field, that we really have to support these young health workers, not only psychologically, but also monetarily and within training to ensure that they don't sort of drop out of their work and that that they can be supported wholly throughout their time. I think I'll turn to Shelley now and to ask you for your thoughts on what are the biggest challenges in your area of work, and how do you see this reflected with young people, as well as what challenges that they'll face if they're not supported in this way.
Yeah, thank you, Catherine. Thank you for having me. I'd like to firstly acknowledge the traditional owners on the land which we meet today, which is Australia, for myself and everybody else everywhere else. I'd like to pay my respects to their elders past and present, and extend that respect to any Aboriginal and Torres Strait Islander people that are present today. Thank you for having me. My perspective might be very different than a lot of other people. I've been in health for 37 years, so I'm getting a bit old in the tooth, but this is from my experiences that I've based some of the questions that you've posed to me. The first one, I really think the biggest challenge that we're facing with our youth in the healthcare sector in rural and remote Australia is an increase in the population's comorbidity rate. So the further west you go, and we say west because it's away from the east coast, where I live in Australia, the comorbidities have increased significantly over the last 10 years, and especially in Aboriginal and Torres Strait Islander population. With that increase of comorbidities, that increases our increased workflow. or work demand on Aboriginal and Torres Strait Islander health workers and our Aboriginal and Torres Strait Islander health practitioners. The capacity is an issue, I think, to deliver gold standard care, and I've come across that. So a lot of the staff are overwhelmed with the workload, with limited resources available to them. Mentorship is a big issue, rural and remotely, because there is a lack of understanding from the mainstream service providers of the role of the Aboriginal and Torres Strait Islander health worker and the Aboriginal and Torres Strait Islander health practitioner. The professional development opportunities are very limited, cost so much. So from where some of my Aboriginal medical services are, they're 10 hours west of the mainstream city of Brisbane. So it is a little bit of a big task to get our staff into the big metropolitan areas to be able to deliver that training and give them access to continuous professional development opportunities. There's a lack of focus on the role of the health workers and the health practitioners in the mainstream service. So there's a lack of understanding of that Aboriginal and Torres Strait Islander health workers and health practitioners actually deliver the best care to their population, to their people, for many reasons. They have a very big cultural capacity, cultural awareness, cultural focus on delivering care, and it's not delivered as the mainstream tick a box. It's very complex. And those health workers and health practitioners have those skills because they're their families as well. There needs to be more address of the understanding of their roles and what they do in mainstream services. In Australia, there's 147 Aboriginal medical services across a huge footprint. And 3.3% of Australia's population is Aboriginal and Torres Strait Islander. So you're equating back into 2016, the stats say there's about 900 Aboriginal and Torres Strait Islander people in Australia. 20% of that population lives rural and remote. The second part of the question was, what are the effects of leaving youth unsupported and supported in these challenges? Huge issues. A lot of the Aboriginal and Torres Strait Islander health workers and health workers start at a Certificate 3 level. They then go to a Certificate 4 level to become a health practitioner. A lot of these kids, and I call them kids, they come through the school system as school-based trainees, and if they're unsupported in those early formative years and don't receive the correct training, they lose focus on what they're doing. There's big holes in data, there's big holes in opportunities of picking up comorbidities and issues with patients coming through the door. A lot of them leave the sector because there's a lot of lack of support. They feel undervalued and feel unsupported in the workplace, which is very sad for somebody starting out in their career. There's a big wage inadequacy in Australia across the states and territories. So there's different rules for different states and territories. Their scope of practice is not equal across all states and territories due to different things. One of the big points in Australia and Queensland particularly is the Poisons Information Act. So the staff, the health workers actually do the training for medication, but in Queensland, they're blocked from actually being able to administer medications because of the Poisons Information Act. The wages are an issue. The award under the National Aboriginal Community Controlled Award is far from the Queensland Health Award for health workers. So there's big gaps in wages between bodies in Australia.
Yeah, thank you for that, Shelley. And it's amazing how big that gap is between the mainstream and then the Aboriginal and Torres Strait Islander health workers and health practitioners as well. And so thank you for highlighting this very important issue, because I think especially, I mean, I personally am also from Australia, so just hearing these statistics and hearing how huge of a gap that is, particularly for Aboriginal and Torres Strait Islander communities, is honestly quite shocking. So thank you for raising this, and hopefully we'll see some change in the future. And thank you for the work that you do in this space, most importantly as well. I'll go to Raj next to also answer the same question. Pretty much just in your work, especially for innovating for the SDGs and most likely the third SDG, what are the main challenges that you see in regards to youth working in this space? And again, what are sort of some of those effects and consequences if they're left unsupported in their work?
Well, thank you, Catherine. It's a great question. I'd say need the correct set of mentorship that every person is meeting in this space, be it in the healthcare production, healthcare consumption, actually bridge the entire healthcare networks, the meaningful innovation and something really impactful. We live in the ages and days and times when sadly the healthcare concerns have been highlighted due to a pandemic. So we definitely don't need a pandemic for the world to having been realized the importance of the healthcare workers and the healthcare arena in general. Second, one major gap that I feel there is in the kind of innovation that is being perhaps not promoted. So a lot of micro innovations which lead to the macrocosm benefits would perhaps work phenomenally at the benefit of humans worldwide, ranging from geriatrics to all age groups. And we need more and more support, which would enable the microcosm to have effective funding, effective channelization of those ideas to the macrocosm. And third, and the most important gap I feel would be, as the speakers before me rightly highlighted, how the entire narrative of SDGs has been partially being pursued somewhere. So to give a little more specific example, you'd find in the healthcare segment between the global south and the global parity, between the purchasing power parity and the overall capacity of the health systems that the governments have been able to curate. So I think having said that, these gaps would kind of need real innovation, and that is what we're trying to do.
Raj, apologies, we can't quite hear you. Maybe if you'd like to turn your camera off and just speak, maybe that might help with the connection.
And what we do is
Oh, Raj, are you still there?
hi, yes, can you hear me? Sorry, some connectivity issue maybe at my end.
Yeah, that's okay. That's okay.
Okay, so just want to mention that yes.
Oh, Raj, sorry, you're on mute. That's okay. I think Raj might be having some difficulty on his end, so I think we might just move to the next question, and then once Raj maybe jumps back in, we can ask him to speak more on this question during his individual question. So I guess we'll move to Amy, a particular question for you. As we've just heard earlier, the pandemic has left quite a huge mark on the youth generation of health workers globally. as you shared earlier, like their experiences that they've been forced to face in their everyday lives have made a lot of them actually decide to just maybe leave healthcare or decide that it's not even for them. You've worked through the pandemic as a PhD nursing student and as well as a teaching assistant. And moreover, you also have research interests in nursing education. So from all of these collective experiences, what stories can you share about nursing students going through the pandemic? And also, what are some of the policies do you think is necessary to support the mental health of youth and also prevent burnout?
Yeah, absolutely. Thank you, Catherine, for posing that question. And I'll just quickly, a quote that I came across the other day from Sheryl Sandberg. The quote is, "To fight for change tomorrow, we need to build resilience today." And I thought that was just such a perfect quote for today's webinar, just speaking to those pieces of resilience, the need for action. So that to fight, and also the consideration for the future. So in my context of nursing, we're looking at, our future clinicians, our future educators, our future researchers, administrators, and global leaders in nursing. So getting through this time of the pandemic, and I really liked even just that piece, the opening title of the document, the call for action, that building a resilient, just that process, like it just really alludes to a process that we're building. So it's something that, we're getting going in this time of the pandemic, but hopefully we'll carry those lessons learned forward into the future and just have that much stronger of a health workforce, and in my context, nurses, for tomorrow. So I just wanted to bring up on the screen, I created a vision board. Oh, perfect timing. Awesome. Yeah, so I really am passionate about the arts within my research. And I thought, just for that process of building that workforce, I thought, okay, let's just see visually what this could look like. And in this question, I'll be addressing the two sides of the vision board. The middle portion I'll speak to in the third section of the panel discussion. But on the one side, on your left side, I just wanted to highlight some of the experiences of students globally, and early career nurses as well, during this pandemic time. And you'll notice there's a big 5 on there. And I did speak to that earlier. Often we were seeing before the pandemic, a lot of early career nurses were, after year 5, were starting to maybe look elsewhere, whether it was leaving the bedside to go into education or graduate studies, or getting completely out of the profession. And the concern now, just kind of looking anecdotally and just gray literature, because it's still early, but we're getting concerned that window will narrow to maybe 2 to 3 years now. So just thinking about, students completing that time in their nursing programs, that investment that they've put into themselves, and then to have, 2 years of practice and then just not be able to go on. That is something that, we've also seen in the literature during the pandemic a bit more now that studies are being able to be conducted and published, because we're at year 2 now of COVID. And seeing it globally, the experiences of students in their nursing programs and also in their early professional years. And that's hence the globe there. There's studies right across the board that are coming out from Jordan, Brazil, the UK, across Southeast Asia, North America, of students teaching and learning experiences that are just so strained. A lot of the learning has gone remote. So you're not getting that same connection. And I think I spoke to a bit earlier in question 1, just my lens is often that our nursing students begin that career first day of nursing school and their nursing education. They start to form that identity, and it's like a culture in and of itself within nursing, and then the greater culture of healthcare, and they're not getting that same connection. They're feeling that isolation. And furthermore, within nursing, and similar to a lot of health care education programs, we have a clinical component where students head out into the hospitals and the community and do their hands-on clinical experience as nursing students. And it's a stressful time for anyone in their education programs, those clinical experiences, and you're kind of putting it all together in the real world. Hence, I've got a little snap of that on the vision board. And it was a stressful time before the pandemic, but during the pandemic, you start to consider all the extra factors. It was alluded to earlier through Pascal's presentation, speaking to, vaccine access, PPE supplies, like there's all these other layers to your learning experience, in addition to just the regular experience of being a nursing student in clinical. And furthermore, I know mentorship has been brought up as well this morning. We have within our clinical experiences, our nursing students are often paired with a senior nurse, but not always. And that's another issue with that shortage, right? Because we're losing nurses, at that 5-year mark. And we are losing those mentors for our future nurses. So it's like a vicious cycle in a sense, because our mentors are feeling that strain and stress. They're practicing in environments that are very unpredictable with the pandemic. And then in addition to that, they have a student paired with them for the day. So it's just such a vicious cycle. I have a photo there at the bottom. It looks like a kayaker sort of out on the open water alone. And that was to symbolize that feeling of isolation. Nursing students are so excited to join the profession, to get out into especially the clinical setting. It's an exciting time, but it often can feel really isolating. They feel unheard, undervalued, and perhaps even lost within this new role that they're taking on. And I'll just quickly speak to the policy piece, and that's to the right side. I tried to come at it sort of from an angle of, how can we sort of learn from what we've gone through and take a bit of a positive, try to see, what's working and see if we can carry that forward into our programs and integrate them, because I think it's really important also to look from a positive lens as well. What's working and what can we carry through and learn? Because as we know, this isn't the last pandemic or the last crisis. There'll be other issues in one's career as you move along. And I have there's a meditation photo there. And that was a bit of an experience in my program. We had in one of our courses, a mindfulness expert come to our seminar. And it was so helpful to spend that hour learning a bit more about mindfulness practice and hearing about those resources and supports. And it doesn't have to be mindfulness, but I think the bigger lesson for me was just having something within the curriculum, within nursing education programs that is psychosocial and mental health related. It's so important to have the resources, of course, of, you think about writing, academic writing, or academic supports, but I think also having that psychosocial mental health support is so important, giving those resources to students and making it okay, because I feel like you can't pour from an empty cup. We hear that saying quite a bit. So important to have that piece. And another potential idea as well. We know in a lot of our programs, we have requirements when you enter the program and requirements to maintain throughout different policies in that regard. And one is typically a CPR or a basic responder course certificate that we all do every year as nursing students. And then when you're in practice, I think another neat policy might be to implement a mental health first aid. And I know there's a few courses that are popping up here and around, but there's so much stigma with mental health. And I think if we make it just part of our day-to-day practice, have that requirement for our students and into practice as well, not only for their patients, but for themselves as well. Because I think of our CPR, it becomes second nature, right? After we do it every year and do the renewal, I think that same piece could maybe be possible with a mental health component. So just to summarize, perhaps some of the images and words on the vision board resonated with your experiences in your education programs or within your practice, and just looking forward to more dialogue on this important topic. Thank you.
Thank you so much, Amy. And I love the vision board. I really love how you kind of visualize all of these ideas on the same space. And I think it's such an effective tool as well to just bring all of these experiences together into one vision board. So thank you for that. Next, I'll go to our speaker, Valeria Esquivel, who is joining in from the International Labour Organization, or ILO Youth. Valeria, it's great to have you here. And so I might go to you now for a question. I know that you've been working in the upcoming ILO report, Get Youth 2022, in particular in the chapter of the care economy. From that sort of work that you've done, what can you tell us about the impacts of COVID-19 on young health workers?
Okay, thank you, Catherine, for your question. Apologies to all. I in my mind, I'm being punctual, and certainly you've been all together for over an hour, so I'm so sorry about that. Just to open that with, I mean, I cannot be more apologetic for a Sunday. Then and I missed what you all have said. But I really wanted to, I mean, in conversation with Catherine and thanking her and all the organizers for the invitation, I'm coming from kind of not academic, but research perspective on young people in the care economy as workers, and health workers, young health workers are part of this. So in that sense, I was in preparing for this presentation, I was telling Catherine that there is very little known in aggregate terms about this workforce. There is lots of, not lots, but there are experiences new pieces of news and some other studies showing how health professionals, young health professionals in particular, have had to face the COVID-19 crisis. Yet, and from those, we know, for example, I'm sure you've mentioned already the high levels of burnout, the fact that young health workers were brought in fresh from university and sometimes without the right elements and PPE. The protection uniforms you need, but there is little known about, for example, social sector workers, which are part of the health and social work on the one hand, and little known also about other young care workers like those in education, for example. But if I have to focus on what the information and the labor force surveys tell us about the situation of young health and social workers, first, what appears is that in most contexts, but not in all, they have been able to remain in employment when the whole young employment or youth employment has contracted dramatically. So, but these stories that we hear from northern or developed economies about young workers being brought in, etc., is not the picture throughout the world. In some places, the fact that, and in the South, the fact that the care systems collapsed and that there were restrictions about resources meant that some young health and social workers lost their jobs. That's one thing. I mean, the picture we have sometimes in mind is a very northern picture. That's the first message. And the second is that there is an extraordinary increase in working hours. The crisis was faced with enormously long working hours. I mean, you are all young health workers, I'm an economist. So when I see that an average is 40 plus, 45 hours, I mean, imagine an average of 40 countries, no? So it's, I mean, it means that every single young health worker work very, very long hours. and perhaps the average went down because someone got sick. So 0 hours in. So when averages are so high, it means that it really happened that the young health workforce really took enormously long working hours, and there are reports, and again, I'm so sorry I didn't hear what you said before, but perhaps you can tell me. There are reports that this can jeopardize the future of these workers, because they might, decide not to pursue their careers because of this traumatic experience. So what we see is that the sector was able to keep the workforce, including the young workforce, when everything was contracting. But this is not everywhere, although it is the predominant picture, and that the adjustment took place basically through hours of work, which were beyond any limit. What I'm saying is that this was more, these hours of work, long hours of work, happen also with non-young or older workers, but it was really very evident amongst young workers. And with that, Catherine, I hope that you can tell me whether this resonates with the things that were said before.
Yeah, for sure. Thank you so much for that, Elia. I think that that's such an interesting input that you have from an economic perspective that really adds to the picture that the rest of our speakers have been talking about so much with, burnout and long working hours. I think we heard specifically from Amy and Manon, and even Shelley as well, somewhat, that, that there is just this strain on the current health workforce, and it's great that you sort of highlighted that from an economic perspective and have brought those points into it as well. So thank you so much for that, Valeria. I'll go to Manon next. And so something that you highlighted in the very first question as well, that a lot of young health and care workers that have recently graduated, they're finding that interprofessional training and high quality mentorship is extremely hard to come by. And we talk a lot about how this need exists, but what are sort of the major obstacles to implementation to address this issue, and how does this sort of differ between developed and lower middle income countries? If you could speak to that, please, Manon.
Thank you. Of course. So I think that there has been a shift in medical education, that we came to the point and said, like, okay, interprofessional collaboration is important. We do need to invest in this. We cannot stay on our island as physicians. We really need each other to take care of our patients. Looking back at my own medical training, I do see medical schools trying to work on this, but at the same time, it's just too little too late. My interprofessional training was 1 week, 4 days, and to me, it felt like just something that my medical school wanted to tick off a box. Like, okay, she can draw blood, she can put on a cast, and she can also work interprofessionally because we trained her for 4 days. And I feel like, yes, we made progress. At the same time, we still don't recognize it as a cross-cutting issue. Like, the interprofessional collaboration is everywhere. It is exactly in that drawing blood where we work together with a nurse. It's exactly in that putting on the cast where we work together with casting nurses or with whoever we work in whatever context. And I don't want to say that it's that nobody wants to invest in it. I also think that there's just too little space in the medical training. Like, there's so much that need to be taught, and it's already so packed that medical schools feel burdened. Like, what do we cut out to replace? Because at the end of the day, we only have 24 hours in a day. And then the issue is that medical schools say, like, well, we can't do it, it's for someone else. But then we go into training where, as I touched upon before, like we're trainees, but also not really, because we don't really see the interior of an auditorium anymore. We don't see the interior of the school anymore. We're also employees, but also not really, because we're still being trained. And so nobody really feels responsible for us. It's always the other one will do it. The hospital will take care of it. No, the university will take care of it. No, the Ministry of Health will take care of it. And in the end, nobody actually takes care of it. And especially for hospitals, like there's a big reluctance to invest in us, because we're like a passing ship. Like we will go off in a year, in 2 years to someone else. So why put in the money and train us in interprofessional collaboration? Because by the time we actually can do it, we will go somewhere else, and they just get in the new flow of recent graduates who never learned it in medical school. So touching up on the other thing that you said about the mentorship, interestingly enough, well, ties also in with the fact that everybody's overburdened. There is no time for anything to be added on people's plates. But also the financing question comes into play there. We are generally not adequately paid, but neither are our mentors, neither are the people who have to train us. Like generally, physicians who train residents in a hospital have to do it before, during, after. They're not getting any support from the hospital. They're not getting paid for those extra hours that they put in. And depending on the system in which you work, like the patients that you're not seeing because you're training trainees is just income that is not being generated. And there are many countries where physicians can just not miss that income. And so touching upon what you said, the difference between high income countries and low and middle income countries, I mean, that is very bluntly, of course, dividing the world in two camps. And there's a lot more nuance to it than just saying like you're camp A or camp B. But generally, the issues aren't that different when it comes to mentorship and interprofessional training. It's just that they're much more exacerbated in LMICs. We have bad mentorship, LMICs generally have no mentorship. We have bad pay, they are not being paid. We have bad interprofessional training, LMICs have no interprofessional training. And it is very bluntly, and again, like there's definitely schools in LMICs who do much better than certain schools in high income countries and vice versa. But it's not that the challenges are very different, or that there's something that is very different in LMICs that would need a different approach. No, actually, it's really just investing in youth and investing in young people. And I think it all boils down to putting your money where your mouth is, and really adequately training the people who need to take care of our country, of our patients, of the future.
Yeah, thank you for that, Manol. And I think it's such an important issue how you've highlighted that strain on time capacity, as well as sort of that training capacity, and then also this monetary capacity, to say that we really do just need to invest in our young health and care workers. And yeah, I think that that's such a profound note that we need to look more into. Thank you for that, Manol. I'll go to Shelley next to speak more from your perspective of sort of the importance of adequate training and specialized training of Aboriginal and Torres Strait Islander health workers and practitioners. And from your work, what are sort of the effects of poor training?
Yeah, thanks, Catherine. Can you hear me? I'll swap to the phone. The computer's not playing nice tonight. Internet's poor in the middle of the night in Australia. All right, no, thank you. I have a big training education background, so I've been heavily involved with training in conjunction with a health practitioner of training Aboriginal and Torres Strait Islander health workers for many years. So the importance of adequate training. It's a really big area to start with, but the stuff that I've done over the years with my health workers and the trainee health workers is to build that rapport for a start. If your Aboriginal staff don't trust you, they won't work for you. So you have to build that rapport with your staff before you start anywhere. They have to learn to trust you and believe in what they can be. So there's a big confidence issue, I think, with a lot of our younger ones that come through the course. But with a lot of training and a lot of consistent competency-based assessments, they get their confidence. So once they've gained their confidence, because they're dealing with people's lives and their healthcare needs. So once they get that confidence, you can see them change and come in as an 18-year-old trainee, and they come out the other end as a 19, 20-year-old health worker. And by the time they've done their health practitioner training as well, they're totally different kettle of fish. So it's really interesting, but competency-based assessment is really massive. A lot of people don't actually learn by telling them. They visually need to do it, or they need to touch and feel of what they're doing, so they understand that what they're doing has a big impact on people's health outcomes. So did a lot of competency-based assessment training, emergency care training. Like Amy said, the CPR, the yearly CPR, but we used to do emergency care and triage every month. And so we'd call a code in the middle of the day or at 9 o'clock in the morning of, you know, somebody having chest pain, and they'd all come running with the emergency trolley, and they actually knew the process, and you do it all the time with them, at least once a month. If it actually did come up in the clinic at any stage, they actually had the skills and the confidence to actually do what they needed to do. Role playing scenario is really big in Aboriginal health, and they really enjoy it, and there's lots of laughter, but there's also lots of serious stuff. Lots of audits to ensure the data, and data is really important. So the project I'm working on at the minute is building sustainable primary health care across Queensland Health. There's 52 general practice clinics that are owned by Queensland Health, and in that the data is a big issue, and I have a big input into the data. So audits in the data inputs and where they're actually putting the data. So what I've found from experience, people are doing the work, but they're not using the patient information recall systems to record it properly, or they're writing it in notes and their databases can't pick up from notes. So it's about putting it in the interface. So data is really, really important on the project that I'm working. And what it does is it enables the data to be extracted and analysed at a clinic, state or federal level in Australia. So for Queensland Health, that's what we're building, is a dashboard database. It enables the data to be transparent and visible. So you actually don't know your comorbidities in general practice or your population base of what you're dealing with unless you have the data. And data talks. Data makes a big impact on planning for the workforce, planning for deliverables, and benchmarking what you actually can achieve. So without that data, it can't be looked at a strategic level, and that has a big impact on the workforce. So for example, there might be a clinic out west that's got 2,000 comorbidities, and they've only got one GP. That's not possible, or does that GP have capacity to deliver really gold standard, great primary health care when he's by himself or herself? So data is really important to have a look at the workforce, and the workforce then can be supported and the structure can be put in to allow for that work to happen. Clinical outcome-based evidence is required, I think, with the training to address potential gaps in service provision. In Australia, they have the Commonwealth of Australian Government or Close the Gap project that's been running for many years, and it's very much around the healthcare needs of our Aboriginal and Torres Strait Islander population, and the Closing the Gap initiatives are highlight the health inequities in Australia in our Aboriginal and Torres Strait Islander patients. So to answer your question, the importance of adequate training, huge. If you don't train your staff properly, you will get a poor outcome. That's not rocket science. If you don't teach them, you're not going to get the outcome that you're looking for. What are the effects of poor training in healthcare needs? Well, exactly what I said before. Poor data, poor outcome for the population. You won't close the gap. The patients fall through the gaps. There could be a series of events this person's missed this, somebody else has missed this, and then you get a really poor outcome for the patient. Retention of their staff and their turnover and recognition of their roles by government really needs a lot of work put into that as well. But that's some of the effects of poor training, from my opinion, my perspective.
Thanks, Shelley. I think it's quite interesting how you've highlighted the importance of data in this sort of training aspect of it, and how important data is in sort of guiding our initiatives in order to close those gaps. So I think that's quite a unique input that we haven't heard too much of from today's panel. So thank you for adding to that as well. We do have a couple of questions from the audience as we're going through. One is directed specifically towards Amy. And the question is, has the COVID pandemic influenced the quality of nursing as well as the education, especially now that it's remote?
Hi there. Yes, thank you for the question. Hopefully, is my voice coming through okay? Yeah, you know what, we're still, I mean, I don't want to speak too broadly because it's just been the 2-year mark. So kind of still, I think future research will tell us a little bit more specific details about those outcomes. It'll be interesting to look at. I think that'll be a good area for research because we've been busy, if you're looking at the literature now, looking at the experiences like right in the moment of COVID-19 and the learning experiences of our students. And then, but it'll be interesting to do some longitudinal research down the road to kind of see what that experience will look like in their practice and also the perceptions of their future patients. So yeah, definitely a good area for future research. We're not quite there yet, but I think once we move a bit more forward, we can do some work in that area. Thank you for the question.
Thank you, Amy. And another question I'll pose specifically to Valeria is more of what are the policy messages of the coming Get Youth report with regards to the young health and social work workforce? If you could speak to that, please, Valeria.
Yeah, thank you, Catherine. Really, we really feel that in order to avoid a crisis like the one we've been through, there is definitely a need for investments in care services and in particular in care, in healthcare and social work. And that will be, I mean, and investments include the things that you colleagues have been talking about, including the training and the support. No, it's not only infrastructure, but certainly when we see investments in the health system, these investments kind of counteract what, for example, Manon said before about the low paid or no pay of young workers. So that is really what we think should be the driving force of improvement, really allocating the resources, or repeating what someone else said, putting the money where we put the mouth. But in that aspect, the report, I have to say that the report collects what the Youth Hub has published as asks immediately, in the midterm and in the long term. So those messages are included in the report, which will be published around July, we hope. But also we make a point about formalizing community health workers, which are normally, usually in southern countries, being paid an stipend and not being treated as workers, and also attract young workers to the social care sectors with better working conditions. There is this assumption that this is a high rotation sector and that nothing can be done because young people will come and go. well, they will stay if they are offered better working conditions and they are better trained and supported. So this idea that high rotation and young people being not serious enough is just created by these high rotation and low wages. So in a way, what we understand is that the investments in the care sectors have to come with investment in the young care and social workforce in order to support the future development of these systems. Thank you for your question, Catherine.
Thank you, Valeria. I think that's such an interesting thing that you've put forward about how these assumptions about what young people are like influence the way people think about investing in the young health and care workforce. So I think that's such an important issue to highlight as well, to think about it from the investment perspective, what the sort of picture of young health and care workers is like, and possibly how we can mitigate that. I think we are going slightly over time, so I'll jump to a closing question for all of our panelists, and thank you everyone for staying on. And so for the closing question, if I could go around to Amy, Manon, Shelley, and then to close us off with Valeria. The closing question is just, how will your organization work with youth to address some of the issues that we've highlighted in this call today? So if I could go to Amy first.
Sure, yes. Thank you for the closing question. And if it's okay, I'll just have my vision board just popped back up to share with everyone. And I'll just quickly highlight one of the points in the vision board that connects with this question. But while it's being shared, I'll just start. We often hear that metaphor of a seat at the table or a voice at the table, and often in terms with perhaps unrepresented individuals, persons, at those in those spaces and places. And recently, I just noted the point of, do we need to be going to an existing table? Can we also be creating our own table? And that's the center of my vision board. Just wanted to kind of bring the experiences together and accumulate into that table. And you'll notice there's words such as power, voice, build, we are resilient. And I just wanted to share a little bit about the table. I'm part of the International Council of Nurses Nursing Student Steering Group. And it's a group of individuals who are all either nursing students, so right through from undergraduate to doctoral level studies, and also early career nurses. And it's a table of sorts of voices that really holds the potential to share voice and to have that power. And additionally, so that point is just that creation of the table. And I feel like today at the webinar, we've created a table of sorts as well. And the hub itself is a table that's just powerful. And those seats are there at the table for students, for youth, for early career practitioners to join and pull up a seat. And just one exemplar of our organization, of our group that connects with today and the points of discussion were last October, we had a student assembly, and which was part of the ICN's Congress 2021. And one of our topics was actually, well, two of them really fit actually with today's topic. One was about the pandemic 19 experience, sort of how that was looked across the globe for students, for youth, for early career nurses. And also a topic was related to mental health and resilience. And I think it was just such a great exemplar of getting that conversation started, talking about it from the earliest days of one's career or one's educational journey in nursing or any healthcare process. And it was at a table. It was a table created by youth, by students, by early career nurses, and it was for that same population. So moving forward, we've got other projects on the horizon as a newer group. But in conclusion, I just wanted to thank everyone for inviting me to this table, to the hub, and to the webinar today, and looking forward to hearing everyone else's remarks.
Thank you so much, Amy, and it's been a joy to have you on this panel today. So thank you for coming along. I'll go to Manon next. If you could also speak about perhaps what JDN as an organization might do to help some of the issues related to youth that we've sort of talked about tonight, and how will this be going about?
So the JDN is an advocacy organization under the World Medical Association. So we have been working for the past 10 years on these issues. And the way that we do that is actually twofold. Like one way we look up higher in the hierarchy and we work together with national medical associations, with the World Medical Association, and really bring the issues of the youth to the table there and say, like, look, this is what is happening. You are the people in power. You have the power to at least lobby the Ministry of Health, lobby the Ministry of Labor, and change things. But of course, in order to bring those voices to higher levels, we first need to understand what is happening in many countries. And so that is definitely also a very interesting dynamic in the JDN, that we have a lot of webinars and panels like we do today, but a lot of sessions where we really give junior doctors from any country in the world the opportunity to share their experience. They don't need to be in any representative capacity. They don't need to represent their hospital or their training program or even their country. They can just share what their personal experience is. And so we collect those experiences and then we try to pack it in one message to deliver. And then I think that the third way that we function is that all those webinars that we do, all those meetings that we do, also it has become a bit of a spider web in how people connect. And it's no longer our members who connect with us and we connect with the medical association. It's also the members among themselves who say like, oh, wait, you in that country, you have the same issue. Wait, oh, how did you tackle it? Or members who share experiences like, well, we have a very good working relationship with our medical association and this is how we build it up. And so that is very, very interesting that actually we see our members becoming empowered and taking ownership of that advocacy and taking ownership of making their situations better in their own country. So I think we will definitely try to continue working down that path.
Thank you so much, Manon. I think it's so powerful how sharing experiences can actually, really propel these initiatives forward. So thank you for sharing that as well. Shelley, finally, I'll go to you and then I'll go to Valeria afterwards. But Shelley, from your perspective, how will Queensland Health work with youth to address some of the issues that we've, again, highlighted tonight?
Yeah, thanks, Catherine. I think a key point for us is to grow our own. Rural and remotely, it's very hard to attract staff to move to a rural and remote location. So the methodology now is to grow our own. So to put local youth through the course to become Aboriginal and Torres Strait Islander health practitioners and health workers. From an organisational perspective from Queensland Health, more needs to be done to identify and rectify the scope of practice for Aboriginal and Torres Strait Islander health workers and health practitioners in mainstream organisations such as Q Health. The main thing is 50% of our Aboriginal and Torres Strait Islander population go to an Aboriginal medical service. Rural and remotely, there's not too many of them around. So the other 50% of our population, where do they go? They either go to mainstream GP practice or they don't go anywhere. So it's all part of the Closing the Gap initiative in Australia to identify that. Focusing on fostering an improved vision for the Aboriginal and Torres Strait Islander health worker and health practitioner workforce nationally, building a health equity for Aboriginal and Torres Strait Islander health workers and health practitioners in the workplace. And so there's a big piece of work happening in Queensland Health with each of the 16 hospital health services, and they're building a health equity strategy to address that. And that's one component of it. Currently, lobbying the national Association of Aboriginal and Torres Strait Islander Health Workers who are located in Canberra regarding the scope of practice nationally and employment opportunities in Queensland Health for Aboriginal and Torres Strait Islander health workers and health practitioners. I think in summary of what we're really doing, our health workers look after their own mob or their own people the best. And I think through education, it equates to empowerment. So if we empower Aboriginal and Torres Strait Islander health workers and health practitioners and teach them correctly, give them the skills, the resources and the support to look after their population, we'll be 100 miles ahead of the rest of the place if we do it properly.
Thank you so much for that, Shelley, and I hope that work goes well within the coming few months and into the future as well. And again, thank you for all of the work that you do in this area because it's such an important area in remote health. Thank you for that, Shelley. Valeria, I'll go to you finally just to close off our webinar. Within ILO Youth, what are some of the key initiatives moving forward to maybe help address some of the key highlights that we've sort of talked about here in this panel today?
Thank you, Catherine. For everyone, the ILO is the International Labour Organization, and you may know it is a tripartite UN organization, and we have a youth employment action plan that is across the house. That means that everyone is contributing to. In particular, the work on young care workers and young health and social work workers has emerged from the ABUSA Global Youth Employment Forum, where the young people told us to kind of research more and understand more and support more this workforce. And that is why we organized this Get Youth report that is coming, that is biannual major report for the ILO, along these sectors that ABUSA Forum had indicated that were important. So I think it is an area where, along with WHO and other UN agencies, we're wanting to work more within the framework of, as I said before, the importance of investments in the care economy as a way to work, what we say, build back better and fairer. And for that, of course, we need your voices. So I think that what we are going to do is keep on knocking your doors to learn from you and hear from you, but also you should know that that with this action plan on youth employment, we are really, really, really worried and working a lot to improve the prospects of young people in the workforce, including in particular the young care workforce. So yes, that is, I mean, lots of work to do in the coming months. Thank you very much.
Thank you, Valeria. Thank you for all of that insight for all of our speakers. Amy, Manon, Shelley, Valeria, and also Raj, who unfortunately has had to drop out because of his internet connection. But thank you so much to all of you. And I mean, I just thank all of you for your work, all of the continued hard efforts that you put into creating a greater future for our young health and care workforce. And so I hope to continue these discussions into this year's Gwen's Youth Hub annual conference later this year. So again, thank you to all of the speakers tonight, and thank you for all of your inputs and insights into these issues as well. I'll hand it back over to Ave to close off this session, and also just speak very briefly before we close up about how to get more involved in this call for action document and how you can sign and support individually as well.
Thank you, Catherine. A huge thank you to all the speakers. It has been a wonderful, extremely interesting and fascinating panel discussion. Briefly, we will be sharing the PDF version of the presentation today with all of you who have attended. Also check out on our social media for the upcoming next steps regarding the call for action. You will receive information about how to join the Gwen Youth Hub, how to be more involved in our activities. Also, you can read the call for action, endorse it, and share it. Thanks for all. Thank you for being here today with us.